we get educated on our health and how to be more healthy and take care of ourselves this morning. Joined by Dr. Roderick Givens. Good morning, Dr. Givens.
Good morning.
Now, March is Colorectal Cancer Awareness Month. You are a radiation oncologist. I really enjoyed hearing what you were telling me just a second ago, and just explain that. What is a radiation oncologist?
Well, radiation oncologists, we're physicians who deliver radiation. We're part of a team, and so people with cancer can be treated either with by surgery. That would be a surgical oncologist. Medical oncologists do chemotherapy, and radiation oncologists offer radiation. And we often work together to give the appropriate treatment to a patient based on what they have.
And I found that incredibly interesting, because you know it's treated, you hear about it, but you didn't know each specialty that each person has. Being a radiation oncologist, can you explain to us the role of radiation treatment in colon cancer?
Well, several roles we have. Depends on the particular case. If a patient has an advanced lesion or advanced disease, oftentimes radiation will be given to shrink the tumor to make it easier for the surgeon to do his surgery.
Which is the team that you
That's
were talking
right,
about.
exactly. In other cases, the tumor may be relatively small. The surgeon may go in, do surgery, but there may be features about that tumor that may increase a likelihood of a recurrence. And so therefore we'll do radiation following surgery to minimize or reduce the chances of the tumor coming back.
Interesting, interesting.
Right.
Well, when we talk about colon cancer, I mean, for those people that are out there that are curious, can you tell us what the symptoms are?
Well, the symptoms vary widely. Can be anything from a change in bowel patterns, whether constipation, diarrhea, bleeding, dark stools, or even what we call decreased caliber, meaning the stool becomes basically pencil thin and people sense a sort of pressure. And even more surprisingly, sometimes there can be no symptoms. And so that's the importance of a colonoscopy at the age of 50 or earlier if there are other symptoms that would indicate that evaluation would need to be undertaken.
And it's interesting, because we heard about getting checked colonoscopy, but we never really touched on the symptoms. One other question this morning. Is there anything that people can do to reduce the chance of getting colon cancer?
Well, there are a number of things, and in general, it's a healthy lifestyle. What's recommended is weight reduction, avoiding the use of tobacco products, high fiber diet, meaning whole fruits, vegetables, grains, that sort of thing. Reducing red meat, and that's difficult. You know,
you gotta portion it, right?
Portion it out and in moderation, but really exercise, appropriate diet with lots of fresh fruits, vegetables, and grains have been shown to reduce the chance of developing colon cancer.
Well, let me ask this real quick. When we talk about exercise, I know everybody tries to curb back eating. When you talk about exercise, is it simply going out there and doing something really strenuous and hard, or is it something as simply as just walking a little bit?
Well, just walking a little bit, walking a lot, swimming, biking. Exercise is basically doing anything more than just sitting back watching the TV. Okay,
just getting up. And
that's right.
Don't tell my viewers to leave yet.
That's right. You can also watch TV while you're on a treadmill.
Right.
But it's a thing of being active, getting your heart rate up, exercising, and what that does is reduces fat. So of course you're looking at cardiovascular improvements as well as overall weight reduction, which help with diabetes, prevention of cancer, and a whole host of other diseases that we can prevent.
Every little thing helps,
Every
right?
little thing helps.
Fantastic. Thanks so much for being here this morning, Dr. Givens, and informing us. We're much better prepared.
Great.
Now,
thank you very much.
Stay with us. We've got more Good Morning Mississippi coming up after the break, and is your memory on top? We'll tell you how it can be.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.